Well, hello, everyone. Welcome. We have about 140 people who've joined so far, and we anticipate getting up to about 500 people. I'm Shannon Hayter. I'm a EIS alumni of the class of 1999, and I want to thank everybody for tuning in today. You might ask, why a number of us EIS alumni got together to rapidly organize this. And I want to give a shout out to my colleagues, Deborah Rugg, EIS 1987, Eric Chow, EIS 2018, Ariella Dale, EIS 2020. But as EIS officers, I can say from my heart, my commitment and passion for EIS is inextricably linked to my commitment and passion for CDC and my commitment and passion for public health writ large. And I think many of us could not let the 4-week anniversary of the shootings just pass by without acknowledging that episode and other episodes and the stress and the pressure on our colleagues still at CDC. And so the goal of today is really fairly simple. It is to really say to our CDC colleagues and friends, our frontline public health CDC champions, that we see you. We see you, we care about you, we value you, and we thank you. And so we organize this fairly rapidly. We have a list of 20 phenomenal public health leaders who we will be able to bring up sort of rapid podium set style to share their messages of support and inspiration. A little bit of logistics. We know that this is a webinar format, so it's not quite as nice as seeing 500 faces that you know up on the screen. And there are some reasons for that. But we are going to be using the Q&A function for those of you who would like to introduce yourself and or where you're zooming in from. For those of you who have messages that you want to share of inspiration and support to your CDC colleagues and our frontline public health champions, please do enter them into the Q&A, and we will be publishing them in real time as we go so that you sort of get a sense of your community who's online in real time while we're here. And we are up to 200 folks in the audience as we go. So without further ado, I think the program is going to have some previous CDC and HHS leaders, our National Public Health Organization leaders, our Public Health Coalition leaders, and then come back to some of our CDC and EIS alumni to really wrap it up and take it home. So I'm pleased to invite to be our first speaker, former Secretary Sylvia Burwell. Over to you.
Shannon, thanks so much, and thanks to everyone who organized this this gathering and this ability for all of us here to make sure that our CDC and public health folks across the country know how much they are supported. And so thank you for the opportunity to be here. Was pleased and so happy that you asked me to join this evening. And for those of you who I've had the opportunity to work with, you will not be surprised. I have 3 things. For those who have had that chance and we've worked together, you knew it would be 3. It is 3. The first thing that I want to do is just touch on this 4-week anniversary and the importance of being clear that violence has no place. It has no place in disagreement in our country. It has no place in how we discuss, resolve, express ourselves. And I'm so sorry, and I know all of us here are, and want to just recognize that, say that out loud, and also say, for those of you who have suffered from that and the trauma of what has happened, that, recognizing that it is not acceptable, but also recognizing that what you all are going through in terms of those who are going in every day, those who are around these issues, and the fear and things that really exist, and calling it out, talking about it, and making sure that we recognize it. And on this call, I hope that we can all give support to one another as people continue in that in that vein in terms of working through and continuing on. And that brings me to point 2, which is a former secretary, as I was thinking about this, and I was thinking about my times, the importance of the work of all of those who have been at CDC, those who are partners outside of CDC, and those who are there right now in terms of that work. And the list could go on and I could take up all the time, but I won't. I will just touch on some of the things that just came very quickly to me. Canoes and the CDC folks who were paddling canoes in rivers to get Ebola tests. And to test people and get to where they were. For those of you who worked with me on Flint, Michigan, and the water, and the lead and those issues. For those of you who were part of bringing together what are some of the most impactful ways that we can try and prevent almost 500,000 tobacco deaths in our country in terms of figuring out the right way to communicate and help people who really want to get away from those issues. I could go on and on. Zika, it was every day, everything. And it's what, when I used to say I was the secretary of the kitchen table, well, it was CDC who was serving the meal most days in terms of what families care about and really need from the government. And that's the thing. Sorry, you all know me too. I do get emotional. It's just so important, this work. But that brings me to the third point, which is there are people all over this country who are thanking you and care about your work. And on this one, I'm going to speak as a mom. I was at my pediatrician for our children, Helene and Matthew, now 17 and 15, for those who've been over the whole arc. And Helene is named for another public health person on this call that you all will also hear from. But the pediatrician was like, what are we going to do? And our pediatrician's like, this is who we go to. This is how we get our information. And so I just want to make sure you all know, whether it's the pediatricians or the moms like me going to the pediatricians, the people all over this country value your work and know how important it is. And it's important to them in their everyday lives. With that, thanks for letting me be here. Sorry.
Thank you so much. Now we're going to go to former CDC Director Julie Gerberding.
Thank you. I really hope, first of all, your words, Sylvia, were a little breathtaking, and it's kind of hard to regroup and focus on delivering a concise message here. But I really hope people participating in this call recognize that you feel uplifted and reassured by this incredible show of force from the whole public health community, really standing strong with you through these really difficult times. I thought I would just focus on one thing, not three, and that is really the concept of courage. First and foremost, really respecting the courage and gratitude for the courage of Officer David Rose, who sacrificed his life in the process of protecting the CDC. But I also think we recognize the courage of the people who were in lockdown, or the parents who were worried about their children in the CDC daycare center, you know, who, in spite of their own concerns about their safety and what was going to happen to them when they ever get out of that building, took time to really contact Judy Monroe at the CDC Foundation and think about how they could be supportive of the family of Officer Rose and initiate at that very early stage the support for that family. We all are recognizing the incredible courage of leaders who are not willing to compromise their integrity and refuse to cross the line in the sand. But it also takes courage to stay. And for that, we are incredibly grateful. Your work is so important, as Sylvia said. And I think it's important that the mission be sustained now more than ever. When you think about it, this was an assault weapon attack on a federal agency in the context of someone who was suffering from severe mental health issues. Those are public health issues, and it is the CDC that is really the front line of addressing the science and the opportunity to intervene more constructively in those situations, and we can't shy away from that. So I'm incredibly grateful and want to really, again, emphasize the solidarity that we all feel in standing strong in support of the CDC and your mission and your courage. Thank you.
Thank you, Dr. Gerberding. Next, I'd like to call to the podium former CDC Director Jeff Copeland. If you can unmute Dr. Copeland.
Okay,
Yes.
great. It's age related. We are headed towards being a nation of destruction, fake science, and preventable diseases and deaths from a bucket of infectious, behavioral, environmental, and other threats. Many of these threats were successfully controlled by a first-rate public health system, by CDC in particular, for its actions. And we can be successful again in grappling with them. However, it will take many years to build and rebuild our public health system itself, including building public trust and support. We need to stick together, seek to build an alliance covering broadly the political spectrum, fight for good science, have leaders with knowledge, honesty, and courage, and we can turn things around. We are headed towards being a nation of once great. We certainly can be great again. And we in public health it's our mission. And it's always struck me as striking when you've interviewed anyone from CDC, from whatever their position was, and asked why were they there and not in private practice or working for a drug company or any of other good things. There's nothing wrong with them. It's just people would say, I'm here because of the mission. And if that mission can be retained, regained, and acted upon, we'll get out of this, but not with a lot of effort. We in public health care about the public at large, and we don't quit. Thank you.
Thank you, Dr. Copeland. I also just wanted to mention former directors Walensky and Fege couldn't be here today, but they also do send their wishes and supports. I think Rochelle Walensky mentioned please sprinkle strength and good wishes at this important time. And Bill Fege mentioned that he had the opportunity to have a full Zoom with current EIS officers yesterday, during which he urged them to be strong and to rely on their friends outside of the federal government to also speak up for what needs to happen. So thank you very much. With that, I'd like to invite our illustrious EIS alumni, former NCHSTP director, and many other things, Helene Gale, to the podium.
First of all, thank you, Shannon, for organizing this. And it is wonderful to be a part of this, and with my colleagues who have already spoken and some who will speak after me. My message is simple, and it's similar to the message that others have given. CDC is an important and necessary and essential organization. And, as Jeff Copeland said, I was a 20-year CDC, 20 plus year CDC employee. And absolutely, people were there for the mission. CDC has never been a boastful organization. It has never been an organization that feels like it needs to toot its horn. It always felt that the good works that CDC does should speak for themselves. And when you're dealing with public health and prevention, these are in some ways the quintessential non-event. If you're doing public health and prevention well, people often don't know it. People often don't recognize the value that we bring. And even with that, CDC employees continue to believe in the mission, no matter whether they got the credit or not. And one of the phrases that Bill Foege often said is that you can get anything done as long as you don't care whether or not you get credit for it. And I think that speaks to the ethos of CDC and what it is. CDC stands for issues that today are no longer seen as things that people want to talk about: social justice, equity, standing for issues that really look at drivers and underlying issues that lead to inequities. And it's important that that it is still okay to talk about these issues, that it is still vital to the mission of CDC to be able to think about the cornerstone, the core of social justice and equity as who we are as CDC and CDC employees. I would also just echo one of the things that Sylvia said, is that, we're here because of a violent act. And while, we know that we are at a very divisive moment in our history, violence is never the answer. And so we applaud all of you who continue, even in the face of such a ugly act, to continue to believe in why it matters to have a CDC. And finally, people talk a lot about trust, and trust is built from trustworthiness. And CDC employees, it is something that I think, again, speaks to who we are. Trustworthiness leads to trust. And I think we will continue to be a trusted institution as long as we continue to remember how important it is to be trustworthy and earn that trust of the public because of our actions. I could go on, but I just want to add my voice to why I think it is so important to keep the courage that Julie Gerberding talked about. Remember the mission, remember why you do what you do. And, there are thousands of us who are here to continue to support you and believe in why what you do is so core to our nation. So thank you.
Thank you. Now I'm going to invite Georges Benjamin, the chief of the American Public Health Association, a true leader and friend of CDC and public health for a very long time. Dr. Benjamin.
Shannon, thank you very much. Good evening, everyone. My message is pretty simple. I want to make sure that you know that you are not alone. You're family. And I really just want to thank you for the commitment to the work you do to ensure that all of us are safe. You should know that I sleep better every night, despite the challenges we have, because I know you're there. And I know you're there because you care about the work that you do. I can assure you, you have not only my personal support, but you have the personal support of the entire membership of the American Public Health Association. Trust is easy to lose and hard to gain, but I reassure you, despite all the nonsense that you hear in the media, we trust you. We trust you because we know you, and we know we've been every day. You're there just to get our backs covered. I tell you who we don't trust. We don't trust Secretary Kennedy and some of the henchmen and women around him. We don't trust them. And we will be continuing to work very, very hard to make sure you get the competent leadership that you deserve. And you deserve competent leadership. No question about that. There's an old African proverb that states, until the tale of the hunt is told by the lion, the story of the hunt will always benefit the hunter. Well, I got to tell you, that changes today. We're going to tell your story each and every day. We're going to change the narrative. CDC has never been an organization that's not competent. CDC has never been an organization that has not been out there working for the best science. You are the gold standard science. You always have been, despite efforts to try to tarnish your reputation. So we're going to tell your story every day. And I think in summary, we got your back. Y'all have a good evening.
Thank you, Dr. Benjamin. Next, I'd like to invite to the podium Lois Pace. Lois is a former HHS Assistant Secretary of the Office of Global Affairs. Lois?
Thank you, Shannon, and thanks everyone, honestly, to speakers and participants alike. It is a shame we can't see each other, but hopefully you feel seen and held in this moment, as Shannon and others have said. I will, well, first off, I'll just say, as a friend of CDC, I never had the pleasure and honor of working at CDC myself, but always looked up to everyone here on my screen and in the virtual room. And I got a chance to work with many EIS alums who ended up being health attachés or other members of my team when I was at HHS. But then even before then was always somebody rallying for CDC, right? And trying to make it right. Even years ago when we were facing COVID and folks were sort of wondering where to turn or who to blame, right? There are many of us who are really trying to make sure that you all could keep doing the work, and we could fight these fires for you, and we could steer people in your direction so that the conversation could be more productive. So thank you for being such a trustworthy and reliable source for people like me, someone who's been an advocate for a lot of my career. I also, though, wanted to share, I guess, somewhat of a personal story, just with my own experience from my time in government, and something that a number of people know, but we didn't publicly share, was how many threats we received in the Office of Global Affairs for the work that we were doing with the World Health Organization. And I remember when it started after we ended up on a couple of political podcasts and blogs for the work we were doing hand in glove with CDC and others across HHS on the pandemic treaty. And it was a really scary time, especially because no one knew what to do to help us. And I kept fearing the worst would happen, at the Humphrey Building or at the US Mission in Geneva or anywhere. We just felt so exposed as people who are just trying to do good in the world. And so I can imagine, I can barely imagine, honestly, how you all are feeling now, just having lived a sliver of that anxiety and really not knowing what to do to help, and having our leaders not really knowing what to do to help. But now, unfortunately, we know that these threats are real and should be taken seriously. And of course, we shouldn't be living in fear, and we should be asked to live in fear. But I think it's an important moment for people to understand the risk we face as people in public health and healthcare. Health workers should not be a target. We say that time and again in conflict and other settings, and we need to be saying it here in the United States of America, or there, I should say. I am currently in Central America. But the last thing I will say, honestly, is thank you, obviously, to those of you who continue to work day in and day out, even facing these unimaginable risks and threats that you should never have to experience. But also, thank you to those of you who have decided that you need to choose yourselves in this moment too. I know it can be a really tough decision to say, hey, I can't endure this right now. My family can't be worried about me every day. And I just want to give you permission to step back if and as you need to, maybe not forever, but perhaps for now. That is a personal decision that I made myself. It's why I don't live in the US, unfortunately. But I know that the work can still continue with the army of leaders that we have, right? It doesn't just take me. It doesn't just take you. And we can't pour from empty cups. And so go refill your cup, go restore yourself, and go make sure that you are ready for the fight in the long run, because it's going to be long. It's going to be really long, longer than we want. And we need you in it, but we need you to be well too. So thank you.
Thank you, Lois. Next, I'd like to invite Carmen Villar to the podium. Carmen is not only a former CDC Chief of Staff, but Public Health Administrator Extraordinaire through multiple levels and venues from Atlanta to Zambia. So Carmen.
Thanks, Shannon, and thanks for having me with you here tonight. I'm gonna say that to the EIS alums, thanks for having the PHA in the room with you. And I think I'm gonna pull on that string a little bit tonight as we talk about how people at CDC over the years in the history have worked together with sort of a PHA and epidemiologist secret sauce pair, because I think it's so important to remind ourselves in this time right now how much we need and appreciate each other and how well we can continue to push forward together with the help of our brothers and sisters. If I look, I can't see all the nearly 400 people on this call, and I'm sorry, I can't see you. But I know from the faces I can see on the call and the speakers here that I have had the honor and the privilege of working with many of you, and having that partnership together, we were very successful. And I've learned so much from people like the secretary that we heard of during the Ebola outbreak, and literally getting her on my phone on a Saturday when I'm going on a run, and she tells me we have to do something and we have to respond. And I get together with the expert in that area, and we devise the response and write it up and get it to where it needs to go and support the people in the field that are doing the work. And that is really the magic that keeps public health together and keeps us all going. So I just wanted to remind people of that as we're in this moment. We sometimes, not only do we forget to give ourselves permission, like we heard from Lois, but we forget to give ourselves grace in that we need to ask for help. And I also learned a lot of that from Dr. Gerberding during COVID, when I was lucky enough to be working with her then. And the way she took care of her staff and checked in with her people made a huge difference, not only in our lives, but in our abilities to perform work, to actually be successful and continue doing our mission-driven work. So I just want to recognize that everybody here is together, and that we need to continue to do that in partnership, in that pair dynamic that we have so beloved over the years and so been successful at CDC with over the years. So thanks again for everybody here. I'm sending much love and grace to all of you. And I hope to see some of you again real soon.
Thank you, Carmen. Next, we're going to shift a little bit to our just critical partner organizations and consortium of public health experts from across our country. I'd like to invite Tim Lashan to the podium. Tim is the Chief External Relations and Advocacy Officer for ASPPH, the Association of Schools and Programs of Public Health. Tim?
Thanks, Shannon. It's lovely to be here with all of you and be part of this vigil of solidarity for our colleagues at CDC. I advocate for the CDC budget on your behalf, as do a lot of other people, and I have great pleasure doing that. You may know ASPPH because you may have been an ASPPH fellow, or you worked with some while you were at the CDC. At ASPPH, we represent the next generation of public health leaders, students, faculty, practitioners, and even our deans, who look to the CDC not only as a scientific anchor, but as a source of inspiration and commitment to public service. When ASPPH signed on to the letter of support, it was in deep recognition of the CDC staff, who are truly the backbone of our national health security. I also want to send our condolences to Officer Rose. It's a difficult moment. I want every one of our CDC colleagues to know your work matters. Your dedication matters, and your sacrifices do not go unnoticed. You are not alone. As others have said, you are surrounded by a vast public health community that stands with you, admires you, and supports you. we ask that you stand strong. On behalf of ASPPH and the schools and programs of public health nationwide, we extend our gratitude to you and the decades of work together with academic public health. We're committed to working alongside you and advance science, practice, communities, and train the next generation to follow in your footsteps. Together, we can be steadfast and sustain the mission of public health, and we will work to assist you in this critical duties. Thank you.
Thank you very much, Tim. Now I'm going to call to the podium Susan Cassandra. Susan is the CMO of ASTO, the Association of State and Territorial Health Officials.
Hey, thanks so much, Shannon. Thanks, everyone, for being on the call tonight. I hope you can feel the appreciation and support. I'm pleased to be here on behalf of our CEO, Joe Cantor, who really wished he could be here tonight, and our entire ASTO team, many of which are on the call as well, to show their support, to again just tell you how much we appreciate you. I actually asked our ASTO team to give me a few words of why they appreciated you so much so that I could share them on our call. And I got way too many responses that I can share in the brief time that I have, but I didn't want to go through a few of what they shared with me to share with all of you on the call. So people shared that they were deeply grateful for you because of your unwavering dedication, your responsiveness, your commitment, for your tenacity, your utmost professionalism, your compassion and fortitude, for stepping up in critical moments, leading and inspiring, for sharing not only your subject matter expertise, but also your friendship, for being brilliant leaders and being brilliant mentors and providing a foundation for many people's public health careers, for persevering through the endless work of safeguarding the nation's health, and for staying steadfast through every high and low, for showing up each day, no matter how difficult, with that selfless goal of protecting the health of others, and for feeding our inner data wonk, our number cruncher, and our graph gremlin, which I know many of you do really well. For every person who didn't miss a family event because of the illness you prevented, for every person who got the right treatment because of the lab test you ran, for every person who didn't become a part of an outbreak because of the response you supported. And they are grateful to you for every person living just a little bit healthier, for every environment that you created that was just a little bit healthier. So on behalf of our entire ASTO team, again, we see you, we really appreciate you. Thank you for showing us every day what public service looks like at its best. We are here to support you and again, stand by you. So thank you, really appreciate the chance to just share a few of these words. And I hope, again, there were so many comments that we received. Hopefully we can share them in some other way as well with all of you. Thanks.
Thank you so much, Susan. And I just want to remind people who join later, if you'd like to introduce yourself or where you're zooming in from, if you'd like to share your own message of inspiration and support for our CDC colleagues, please enter them into the Q&A function and we'll be publishing them real time to be able to share while you're here. With that, I'd like to invite Lori Freeman to come to the podium. Lori is the CEO of NACHO, the National Association of County and City Health Officials. Lori.
Thank you so much. On behalf of the over 3,300 county and city health departments from across the country, which represent a workforce of over 180,000 employees, NACHO, our board, our staff, we want to say thank you and how much we appreciate each of you. In perhaps the worst of ways, we also kind of share a dark kinship of sorts with you. The violent attack on the CDC, as many of you know, played out in different ways in our health departments across the country throughout the pandemic. It's in this shared experience that comes extraordinary empathy and understanding for how it feels to be targeted. When you're in the business of keeping our country safe, we want to also unequivocally recognize that the CDC is the longtime and current federal arm of our three-legged governmental public health system. Your value, your contributions, the importance, the undergirding to that public health system may be improved, but it can't be wholly replaced. It can't be eliminated. It can't be decimated at the risk of harming us all. We also know it's the people that are the public health, and the staff of the CDC are at the heart of the agency and its work. And that yours represents a lot of personal and professional sacrifice just associated with committing to be a public servant, let alone working in the area of public health, which requires its own special commitment. With our close partnership with the CDC, I've had some of the greatest pleasure of my career working with smartest, most knowledgeable disease prevention and public health experts in the world, and the most humble of experts whose only mission is to advance the work of public health to keep communities safe, healthy, and well. Sadly, these are some of the same CDC colleagues that are no longer with us now. Not only does this represent historical loss of a critical institutional knowledge, but a deeper heartfelt loss of expertise to our field from colleagues that we trusted because of the work that we did together and the shared passion to achieve better outcomes and the common mission that we shared to get this work done. Even with the losses, it remains absolutely imperative that we continue to value the CDC as our national institution of and for governmental public health, an appendage of our governmental public health system partnership necessary to its success at all times. And we have to lift up all of our CDC colleagues, those with whom we had the pleasure of working with in the same capacity, but whom I continued, we might no longer be working with you all, but I love seeing your active voices and I love seeing your faces on today's call. But as importantly, our remaining dedicated CDC professionals who have the courage to remain. Let us all continue to come together for you and take care of our public health community. You have experienced some significant and multiple traumas. Let's hold each other up and please know you can always count on NACCHO and the local health departments of the country to champion you. Thank you.
Thank you, Lori. Now I'm going to call to the podium Sarah Kimball. Sarah is the president-elect of CSTE, the Council of State and Territorial Epidemiologists. Sarah.
Thank you. It's a privilege to be here today and listening to all of the inspiring words and seeing what comments people have put in the Q&A. It's hard to know what I can add to that, but on perhaps a more personal note, I was first introduced to the Centers for Disease Control and Prevention when I joined the Epidemic Intelligence Service in 2010. And I just remember as I went through the summer training course in Atlanta, together with the rest of the incoming EIS class, I realized I had found my professional soulmates. These were people who were scientists, physicians, nurses, occupational therapists, veterinarians, and other professionals. They were all nerds who were passionate about scientific inquiry, and they loved a good outbreak story as much as I did, understanding root causes of diseases and how to solve them. But above all, it was a community of people who were deeply committed to using their scientific knowledge and the tools of epidemiology to improve the health of our nation. And they still are. And many from my EIS class went on to work at and still work at the CDC. Others have joined me in working at their state, territorial, local, and tribal health departments. And I know that personally, and I know that my colleagues working in the field of applied public health know what dedicated, humble, and truly amazing people make up the CDC workforce. We rely on their expertise every day. So in light of all this, the targeted attack on August 8th came as a shock to our entire public health community. It feels personal to all of us. So we offer our heartfelt empathy to friends and colleagues who were on the campus that day, who weren't on the campus that day, but had their offices affected, entire agency, and to Officer Rose, who died defending his community. So we want you to know that your state, territorial, local, and tribal colleagues see you, value you, the dedicated, passionate, and capable people who have done their best to push through the trauma they've experienced and have shown up every day to stand by sound science and support safety and well-being in every community. So we offer our ongoing recognition and support to all of our public health soulmates. Thank you.
Thank you, Sarah. Now I'd like to invite to the podium Raynard Washington. Raynard is the chair, Big City Health Coalition, which is comprised of 35 of our biggest cities. Raynard.
Good evening, and as I'm sure most folks here this evening feel, I wish we didn't have to do this, but I am so grateful to be here tonight to participate in this moment of solidarity with our colleagues at the CDC. As was just mentioned, I am the health director in Charlotte, North Carolina, but also represent the 35 largest cities in the country, the network of health officials in Big Cities Health Coalition there, and just want to take a quick moment tonight to just express our support for all of our colleagues at the CDC, and not just the CDC, but all of the operating divisions and HHS. We know that the attacks that are happening right now, both political and even physical attacks, are truthfully an attack on not just the institutions, but on truth, on data, on science, on all of us as individuals who are public servants. And this is a moment for all of us to realize the importance of togetherness. And the importance of us supporting one another through this, not just what's happening federally, but also what's happening in states across the country, and also what's happening in local communities. It's already been mentioned tonight. Our work is so interconnected. We at the local level highly rely on you all at the CDC and other federal agencies to provide guidance and resources and technical assistance. And that trust, despite the noise that we hear, is still there. Me and my colleagues are still looking to the CDC for those resources as much as possible, and want you all to know that we're here, not just as receivers of that information or supports, but also in the fight with you. We will continue to use our voices collectively to speak up, not just for the CDC, but for public health at large. And we'll continue to do that in a very loud way. We know that this is not our first fight. In fact, we've been kind of fighting this fight for quite some time now, since the start of the pandemic. But I do believe wholeheartedly the truth can win, and that we together will be able to fight. And so, for you all, just know we have your back as much as we can, and we are here to support you all. And in truth, there are future generations of folks who need us to be in the fight. I was just at Drexel this week at the Urban Health Symposium, and a lot of young students there in public health who are scared, who are nervous, and don't know what to expect for their future careers. And we worked really hard to reassure them that those of us working in practice now are working hard to ensure that we protect not just these institutions and the work that we do, but that we protect health, so that people are here, that we don't have unnecessary death and morbidity in our communities. And so thank you all again for all that you're doing. Thank you for those who are there, who are still there, to those who have left, to those who are on the sidelines fighting and loudly speaking. Thank you all, and thanks for having this tonight.
Thank you, Reynard. Next, I'll invite to the podium Scott Schoen. Scott's the president of APHL, the Association of Public Health Laboratories.
Thanks, Shannon. I really appreciate the opportunity to speak this evening. The entire team at APHL, our board of directors, and our members throughout the local, state, and territorial public health laboratories remain steadfast in our commitment to support our family at CDC. And that includes the LLS fellows who are part of the future of our public health laboratories across this country. The events from 4 weeks ago, as discussed earlier, have left us all in shock. And while we continue to grieve for the loss of Officer Rose, we do remain grateful that none of our colleagues and friends at CDC were physically harmed. We admire you for being able to continue to perform your jobs. We appreciate that continued dedication to protect the health of the entire public in the face of this trauma and physical violence. And we honor your commitment to serve the greater good through this public service. Please know that the entire public health laboratory community respects you. We trust you, and we value the work you perform every day. APHL and our members will always be a partner through the challenges and those successes that are definitely forthcoming. Thanks, Shannon.
Thanks, Scott. Next, I'd like to invite Jay Nadine Grazia, who is the president and CEO of Trust for America's Health.
Thank you, Shannon, and thank you for the opportunity to be with all of you today. I am so honored to be with you and grateful to be with you. As Shannon said, I'm the president and CEO of Trust for America's Health, which is commonly known as TIFA, and we are a public health policy research and advocacy organization. But before joining TIFA, like you, I was in federal service at HHS. I was previously the Deputy Assistant Secretary for Minority Health and Director of the Office of Minority Health at HHS. I had the honor of serving in that role for about 6 years, and I know and understand the honor and the responsibility of public service. And on behalf of our entire team at TIFA, I just want to say thank you, as so many others have said, truly for your steadfast and your noteworthy service. You are indeed the front lines of promoting and protecting the health of our nation, and we could not do it without you. Your expertise, your experience, your commitment to service are just so critical for our nation's health and security. At TIFA, we really work shoulder to shoulder with so many of you across CDC, and we're so grateful to see the way in which you have such a tremendous impact on improving the health of communities, on working with partners at all levels, in community, in states, and tribes, and territories, and around the world. And I must say that I had firsthand experience in witnessing this when I joined HHS as a fellow in 2008. So many of you taught me. So you taught me about public health and prevention as a fellow and as an early career HHS official. And I continue to be so grateful for that. Let me just conclude in the words of Dr. Martin Luther King Jr., who once said that life's most persistent and urgent question is, what are you doing for others? I must say that what you do at CDC, how you serve the American public, that exemplifies the call to service that Dr. King urged so passionately. And I just want to say again, thank you. We are with you. We stand in solidarity with you and so admire your service each and every day. Thank you, Shannon.
Thank you, Nadine. Next, we're going to shift a bit. I think a characteristic of CDC always and forever is its mission drivenness and the mission drivenness of the people. And we have the opportunity to invite in several important coalitions of people who have come together around shared mission. So first, I'd like to invite Barb Marston to the podium. Barb is, of course, EIS 90. She was a CDC leader in Atlanta and Kenya and beyond. In her latest retirement, she has been coalescing and convening the CDC Alumni and Friends Coalition, Barb, and was very instrumental in helping to organize today. So Barb, over to you.
Thanks so much, Shannon. Yeah, I retired in 22 and I was planning to play with salamanders, but public health keeps pulling at you. And I just I'll put the Alumni Network email in the Q&A in a minute. If anybody wants to do that, please do. But know that without even trying, we've recruited 500 and something people who are advocating for public health and advocating for public health workers. And I don't just mean people who did EIS. I'm really glad to see the PHA representation and the laboratory representation, but it extends to everybody at CDC, the administrative staff, the security officers. Everybody is critical to this mission, and we're there to support the entire gang. If anybody has ideas for specific things we can do to support current staff, we'd love to hear about that. I wanted to just quickly say in some of our advocacy work, we encountered a clinician from Minnesota who reflected, it was a friend of his, but reflected on CDC. He goes, well, what's the importance of CDC? He goes, what's the importance of CDC? That would be like asking, what's the importance of the sun? So I think that was a pretty good way to capture what y'all do. And then the last thing I want to do is just echo what Lois and Dr. Gerbening and many others have mentioned, which is to talk about the courage that it takes to be in public health at this time. And I know not everybody has a choice about whether they're staying or going. Some have been dismissed summarily. Some have to stay because of work requirements, and others are making decisions based on different factors. But I think it's a very compelling issue. The other thing is, we hear a lot about skepticism about the work that's going on right now. And of course, it's good for people to be skeptical. There are influences on what's coming out of CDC that make us have to be skeptical. But I think bottom line, there's still a tremendous amount of really good work that's going on. And I want to acknowledge that. And the last thing is, I think I was slightly known, maybe outshone by Ann Schuckett for silly poems and silly songs. This is obviously not the time for a silly poem, but I did, in the spirit of the EIS conference, write haiku-like thing about this. So I just want to read that briefly. And it just says, we all have our lines. We can't cross. We took an oath. So some bravely leave, but good work goes on. The nation's health depends on it. So some bravely stay. And thanks to everybody that's hanging in there.
Thank you, Barb. Next, I'm going to invite Greg Gonzalez to the podium. Greg is a longstanding public health advocate, champion, and scholar, and he is recently a convener of Defend Public Health Coalition. Greg.
Hi, everybody. So in November 2024, I convened 5,000 of my closest friends to fight for public health and biomedical research. And first want to say, tonight we're remembering Officer Rose, but we also should remember his wife and his 2 children who he's left behind. But there's a couple of messages I want to send to everybody here. To everybody at the CDC right now and those who've recently left, we see you, we hear you, we love you, we'll fight for you. We have 5,000 people who at nights and weekends, not their day jobs, they're on their own time, who are willing to devote time to defend you and to fight for the work and the mission that you uphold so dearly. 2, this is a really painful time to be in public health, whether you're in federal service or you're at a local health department or you're in academic public health like I am. But it's never been more important than it is right now. So many things are in jeopardy that are worth saving and worth fighting for. And I see Greg Millett here and I saw Helene Gale here. This isn't our first time at the rodeo, right? We've been through these fights. We know what to do. We know how to mobilize. And the last thing I'll say is we are going to win, right? This is a moment in time that will pass, and people like RFK and others will be in the rearview mirror, and the rest of you will go down in history for the courage and diligence and perseverance that you've shown over the past few months and weeks. Thank you very much.
Thank you so much, Greg. Now I'd like to invite Abby Tigg to the stand. Abby is from Fired But Fighting.
Hey all, thank you so much for this opportunity. I have to admit I'm fangirling a little bit over all of the very impressive people that have been speaking, and I feel a little strange being someone to be speaking to you all. But as some of you know, I was fired in February from the CDC, and since then, myself and hundreds of you all at CDC and who have been fired as well have, come with courage to advocate for public health together. And I am just so thankful for all of you and always impressed by the compassion you come to, like you have for other people, even when that compassion is not always returned. And while there is no silver lining to this, I will say that it has been amazing to see the breakdown in silos across the different centers at CDC and how we have all kind of come together to share information and come together in solidarity and support one another through this really, really tough time. And I'm just so grateful that you all have trusted me to help be a voice for you all and your work and the American people. And something that I keep telling folks is that the narrative about people at CDC is clearly wrong. And you can see it in our own efforts, right? We have hundreds of people who volunteer their time to make sure the American public know what's happening to them when we probably should be looking for jobs. We're doing it for free, and we're doing it because we feel so deeply passionate about the health of our country and our citizens. And I am just so grateful for the opportunity to work with you all. And if folks are interested in joining our fight, you can check us out at firedbutfighting.org. Thank you.
Great. Thank you so much, Abby. We have 3 speakers left, and we're going to bring it back home to our CDC alumni. If you haven't had a chance yet, I urge you to go ahead and send your own messages of support and inspiration into the Q&A so that we can capture them and publish them. With that, I would like to invite Dan Jernigan to the podium. Dan is, of course, EIS 1994. He has been a center director for the National Center for Emerging and Zoonotic Infections, and he's led our country in the response through many outbreak and epidemic over time. Might have seen him a lot lately. So we're grateful that he had time to be here with us today. So Dan, over to you.
Hey, thanks very much. And yeah, I have really only one real comment or one point, and that is just to thank everybody. I've gotten so many emails, texts, calls, etc. It's incredible. It's also great to see folks on the phone that some of you actually took a chance on me in leadership years and years ago. Some of you actually I got to take a chance on who are now in positions of leadership, and it's incredible to see that. Thanks to everyone. The collective amount of public health on this phone is on the call right now is absolutely impressive. And if there's anything, Shannon, you could do, if you could bottle this, I think somebody said let's sprinkle this around. But I think what it really shows is the importance of being together, and how important that is right now for all of us that are trying to fight what is a really incredibly bad situation right now. I think, I've been in public health for 31 years. I've had the opportunity to work with incredible scientists to do things in the field where it's been dangerous, and we've had the difficult situations in Ebola, SARS in Taiwan, et cetera, where we weren't sure what was going on, but EIS, the staff that were there, the laboratorians, they all, ran to the problem, and actually, working together, actually were addressing those issues. And so that's why this most recent attack, which was 4 weeks ago, is really so disturbing. I had the unfortunate opportunity to be in Building 16 when all of this was happening. And so one of the bullets actually hit the floor below us. And so it was an awful time. We've been able to do things in terrible situations, but I don't know that we were prepared for that one. We were able to look out the window and see the fire department pull away and try and get people to turn around. One of our immunization safety office leads was actually in the daycare center parking lot and was in the floor of her car waiting for the shooting to stop so that she could go inside and take care of her daughter. So this was it was a terrible thing. It was a physical attack. It was awful. And we mourn the loss of Officer Rose. We support his family, and I really appreciate the work that all have done in order to support him with some resources. But none of us were physically hurt, but the attacks that have been on CDC have just been continuous. It's been essentially a death by 1,000 cuts. We've had cuts to staff, we've had cuts to resources. There have been undercutting of our science, and all of that's leading to an undermining of trust. And so the way I think to really turn this around is by the actions that all of you have been doing, and by turning that up a little bit more and making your voices known, because I think it's so important now to support CDC. One of the things during that shooting that helped a lot of us that were in the building was that we were actually there together. It was me, our associate director for lab sciences, policy people, Eric, the goodwill guy that cleans up the place. He was there with us too. And I think the importance of being together was really critical at that time. And so just as we go forward, the importance of being together, the support that you all provide to us, I think is incredibly important. I had said before leaving that remaining is rebelling. I am not able to remain, but I can continue to rebel. And I really request everyone else working together, being together, rebelling together, I think will be an important thing so that we can keep CDC alive, keep the public health mission going, and keep us pushing toward evidence-based scientific work that will help us make better public health decisions. So thanks very much, and really appreciate all the support that everyone has been giving.
Thank you, Dan. Next, I'm going to invite Greg Millett to the podium. Greg is a CDC alumni from Atlanta to the White House and has spent his career really helping not just to collect data, but to make data speak for policy and action. So Greg, over to you.
Great. Thank you, Shannon, for assembling this crucial family gathering. And that's exactly what this feels like. I see so many friends and mentors and colleagues online, and the last hour has really been inspiring. My parents were immigrants. My mother worked at the United Nations for decades and instilled in both me and my sister the importance of service. It stuck. I'm proud to have worked as an epidemiologist at CDC for 14 years, and even more proud of my friends and colleagues who continue to get the important work done to keep fellow Americans healthy, despite increasingly troublesome events. Every time I'm in various policy or scientific meetings here in DC, I always mention with my head held high that I'm a former CDC employee. I can do that because of all of you. Although you hear from a vocal and misinformed slice of the American public every day, your expertise is critical and valued by many more Americans. I never thought that I would see the day that our government would roll back prevention programs, bottleneck the release of critical data, destroy the pipeline for a future generation of public health professionals, threaten current employees, or encourage an atmosphere that incites violence against health professionals. But here we are. You are heroes who go to work every day despite incendiary and problematic rhetoric and even more troublesome policies. We see you, and we all pray for you every day. Thank you for your service and for continuing to make us all proud of CDC.
Thank you, Greg. And finally, I'd like to invite Judy Monroe to the podium. Judy is currently president and CEO of the CDC Foundation. CDC Foundation plays a critical role in serving CDC and all of us, hosts the EIS Alumni Association. But importantly also, Judy's a former deputy director of CDC and was a transformative director of CDC's Office of State, Territorial, Tribal, Local, and Territorial Support. So Judy, bring it home.
Oh, well, thank you. And what a privilege to join this lineup of amazing speakers and to speak to all of you tonight, join the family. As you've heard, I've had a first row seat for many years watching you give your all to protect health and to help and to protect others. And I wanted to go back to 4 weeks ago because you're under fire. Officer Rose has lost his life, and I started receiving emails on Friday night asking if the CDC Foundation could help you all stand up a fund for his widow and his 3 children. So that was your first instinct, was to give back and to support the family. And through the donations that came in, there were 4,800 donations, well over $400,000 will be going to his widow and children. So very privileged to do that, provide that platform for you all. I have watched you all work through pandemics, outbreaks, and political storms. And what I've seen is you always stayed steady when the world was trembling. I've watched you miss birthdays. I've watched you work holidays, and I've watched you put yourself in harm's way. And all of this you've done quietly and humbly and without fanfare. And always with the utmost integrity, which is so critically important in today's world. So we need you, we see you, we love you, and you're not alone. Please let us know how we can help. Thank you.
Thank you so much, Judy. We stayed pretty close to time. I'm going to wrap this up pretty quickly. First, I'd like to thank all of the panelists for joining with very short notice and last minute. I'd like to thank my colleagues from American University who helped us operationalize and get the logistics to make this happen. But mostly I want to thank all of you who have tuned in. We had 350 to 400 audience members almost throughout the entire hour. And this is really about being able to gather. I think, as you might have seen in some of the advertisements, showing up in volume speaks volumes. We know that there are many people who couldn't join today, and we know that the impact on CDC is felt, yes, in Atlanta, but also around the world, including our LES staff at embassies and CDC offices all around the world, who have always been a critical linchpin to our partnerships to other ministries of health, but also other CDCs and other national public health institutes. So please, as you leave here and over the weekend, spread the news. Reach out to some of your colleagues that you haven't had a chance to connect with recently. Please spread the sentiment that we came here today about, which is we see you, we care about you, we value you, and we want you to know that we thank you. So thank you all for tonight. Thank you for what you do, and don't go it alone. Let's continue to bring our community together. Thank you.